Well, folks, it's 3 on the nose. We're going to give it another minute. We certainly anticipate, the day before the long holiday that maybe have a lighter attendance than normal today, but we are looking to push this out like we do the other ones on the YouTube and on our website, and can push it out for folks to view after the fact. Bonnie, you just put up a question about, do we have a Huntsville District Summer Athletic Plan to share? Yes, I think, Michael, that should be on our website. Is it not at this point?
I will take a look at that, but if not, we'll make sure it is.
Yeah, so we just talked the other day, getting that up ASAP. So, Bonnie, we'll confirm that and send a message during this meeting.
Great, thanks. I might just not know where to look for it.
Yeah. So for those of you who don't know, Bonnie's referencing last week, we interviewed Jeff Wilson with Huntsville City Schools, and he had a pretty neat deck that he prepared on summer program and athletic protocols and how they're training their staff on safe hygiene and practices to start athletic practices, which they have already in June, and now planning for July as well. So, all right. Well, I said it's 1 minute past, and let's go ahead and get started. And want to appreciate Mary for being here today and her packed schedule, and certainly Todd and Debbie from Goochland, who will be doing a presentation for us and letting us a little bit about their reopening plans, what they've been doing to date. As always in this format, we use the chat heavily, so please go ahead and use that and post any questions along the way as we go. Just brief introduction. My name is David, again, with Cooperative Strategies, K-12 planning firm, and we've been hosting these now with National Council on School Facilities and Mary for several weeks now, a couple months actually. And Mary's been working on I would say months now, not weeks. Mary's been working hard on with her team to actually provide a website as a database, a resource that compiles the work we've been working on to date and incorporates other things from the National Council of Academy of Science, Engineering, and Medicine, and others. So, perfect. So let's go ahead. I'm going to share my screen, and we are going to get right into it and start. I just have some placeholder slides here. Just Mary, welcome back, and you have the floor.
Thank you, David. So there's, I think, really the main thing to update folks on is what just happened this week, which is not the HEROES Act, which is a different piece of legislation before Congress, which has to do more broadly with state funding as well as assistance to individuals because of the economic conditions, but and that is the HEROES Act is HR 6800, and if, I don't know, David, if it's, I don't know that I need to show my screen, but you can certainly look that up. It has emergency supplemental appropriations for federal agencies, direct payments of up to $1,200 per individual, paid sick days. It modifies the Paycheck Protection Program. There's, tax credits, eliminates cost sharing for COVID treatments, requires employers to develop infectious disease exposure control plans. So it's very, very focused on this crisis that we're in, and obviously very important that we continue to do that because it is clearly not gone away. So even though we're all tired of it, it isn't tired of us yet. So I think that's an indication of how important it is that we continue to focus on that. But another really important thing happened this week, which was that the infrastructure, what's called Invest in America Act, which is HR 2, and it started out as just a transportation and traditional infrastructure act. And then on June 22nd, other provisions were added, and for example, schools and childcare were added, K-12 public schools, and in these, what's basically an infrastructure stimulus act is $130 billion for school facilities. $100 billion is in direct grants, and another $30 billion is in bond subsidy program. And this would be allocated, according to this bill, over 5 years, and that's $20 billion a year. It would go to the states, and the states would be required to set up a program that gets these dollars to the highest need, lowest wealth districts. So that's a really important aspect of it. It's really about the equity issue and eliminating some of the poor facility conditions in our poorest districts. So there was a vote on it yesterday. It passed the House and will go over to the Senate. There's an identical bill that's already been prepped in the Senate that Senator Reid had introduced, but it is it's going to be a matter of getting public pressure and some public consensus in order to get it through the Senate. But it's the first time there's been a major school facilities bill passed the House, and really the first time it's been integrated into other critical infrastructure. So it's an important step, but it's certainly not one you can't go to the bank with it yet. But when you do go to the bank, it'll be real money. So
yeah, right.
So I don't know. Are there questions or comments, and then you all can get to your to your agenda? I would love to stay and listen to it as well.
Well, this is Bonnie from Salem Kaiser Public Schools in Oregon, and I would like to thank our representative from Eugene for pushing that. Awesome. I've also seen that the Republicans are saying it has absolutely zero chance in the Senate. Right, and that is certainly what we're hearing as well. We think it's probably not zero to the extent that it might be possible to pull out the fiscal 20 billion associated with the reopening. I think people are anxious to see schools reopen, and I think there's some concern that the buildings aren't as ready as they need to be in order to reopen. So it may be that the reopening converges with the conditions to bring about some kind of consensus on that. But I think that part of what it says to me is it may not be now, but it will be soon. I don't think we can sit back, but I think, yeah.
Mary, Guy,
Hi, Guy.
What did the bipartisan support look like in the House?
It was pretty much on party lines. I believe there was at least, and I haven't gone specifically into it, but I know that there was a Republican co-sponsor of the bill originally from New Jersey. But I think that people realizing that it would pass without their votes, I think that there was, not a lot of incentive to join, from a messaging perspective, that it was probably going to be safer to sit back and let it pass. But I think that, I think it's going to be important to, make the case, as frankly, the state officials have been educating our federal officials on this for a while, and I think they need to continue to hear from the public. And in particular, one of the things about
I mean, I know that President Trump made some comment about, oh, you know, this is not a good bill for rural states, but it is, from the facilities perspective, a really good bill for rural states. And I know I went and I looked at it, and certainly on a per pupil basis, there's a higher share that's going to rural states than to non-rural states. I mean, as it should be, because there's more square footage needed in rural America to deliver public education because of the low density, and you still need a room. You still need the building and many of the support spaces. So, but so there's clearly a lot of communicating and educating that's going to need to take place at the in the Senate.
Well, thanks, Mary. And we'll keep our eyes peeled on that HR too, and then see how the debate goes. If you haven't seen the American Academy of Pediatrics position on school reopening, it's certainly something I think that's valuable to look up and read, as it puts a strong emphasis on returning to school more aggressively than, frankly, I was a little surprised about how strident it was in that respect. And not a judgment call on it, but it was very much worth a read, and certainly will be something that we'll all be wrestling with. So I want to pivot here and welcome and thank Debbie and Todd from Goochland in Virginia for preparing to speak with us today and share a little bit about their reopening plans. They have a deck that they're going to share and walk through. And so with that, I'm just going to go ahead and share, stop share here and let Debbie and Todd introduce themselves, a little bit about their district. Y'all been joining the webinar series since the beginning, and have had a lot of value and comments and good questions. So look forward to turning the tables a little bit and hearing a little bit more about your plan. So I'm going to stop the share, and Debbie, please feel free to share your screen and introduce yourself and Todd.
All right. Just a second. Got to find that screen again.
Should be bottom of your screen.
No.
In the middle.
No, I was trying to find it to share it.
Ah, there it goes.
So, sorry. I lost it. I think you can see what I can't see. Just 1 minute.
No sweat.
There we go. Oops. No. Well, shoot.
Says you started screen sharing, but we don't see anything quite yet. Oh, right. There it is.
So can you see it? Good. All right.
Yeah.
So I'm Debbie White, and I'm the Chief Financial Officer, but I am involved in a lot of the special projects that occur at the school division, a school division of our size with only 5 schools and 2,600 students and 500 full-time and part-time staff. That means that we all hold lots of hats. So I get involved in all the capital projects as well. I do all the procurement. So a lot of what happens, I work very closely with Todd, the facilities manager, on all those capital and operational needs that he has. We are a rural school division. We're sort of narrow. We're sitting right to the north of us is I-64 that I know goes way out west. I take it all the way to my relatives in southern Indiana, so I know it goes beyond that. And then to the west, to the east of us is Richmond, the city. So we have a lot of people that commute back and forth to the Richmond metro area. So that means that we are involved with whatever is happening COVID related in the Richmond metro area. When Mary talks about this new infrastructure bill. I am excited that it's going to happen, but we are considered a wealthy county and we will not be recipients of that federal aid, I'm almost sure. Virginia is in phase 3 of their reopening strategy, and we have been keeping very tight. And I'm going to describe how that affects some of our decision making for our school division. So let's see if I can move the screen. There we go. Oops. For some reason, although it's in presentation mode, it is not moving forward.
We see it.
Yeah, so this is the NPR recommended global epidemics map tool, and you can see where I circled. This is where we're located. We're predominantly yellow, which means we're holding steady. So moderate risk right now. Our governor is a pediatrician, and so health plans are very important, and a lot of the decisions are based on pretty good science and what's coming out of the CDC. Everything we do has to have a health plan. So if we go into athletics, summer school, our reopening plan has to be pre-approved from a health perspective. Can't do it. Sorry, I had to move it another way. I did want to go into our office reopening strategy because for Virginia, that is different. There is Virginia published workplace guidelines. We are not right on the same guidelines, but our local government is. So today, the state moved, yesterday, the state moved into phase 3, which means that all buildings could be open. And we are not going to do that until July 6th. But what happened is during lockdown, everybody went into remote work. And I will tell you that I personally live 90 miles away from where I work. It's an 1.5-hour drive, all on the interstate, not too bad. But I have only been back to Goochland 5 times, and I run a lot of activity in the school division. Like many of my colleagues, and Todd will tell you the same thing, we have been working probably 60-hour weeks since we went into lockdown with all the uncertainty and changes. But I have great staff that go in about once a week, and so we're able to clear all the paperwork, all the procurement. We've been able to get some big RFPs done. So we've got some capital projects that are moving along like on schedule. But in that lockdown phase, I think my staff and Todd's staff were the only ones that were allowed on site. So, and we had to only come in one at a time. Then we moved to, in the middle, the 1st of June, we moved to what I call step 1 because I didn't want to confuse it with phase 1 of the Virginia plan. We have been open for appointments only, and everybody is still working remote. So on Monday, we start step 2, which means we're going to have set hours for the buildings to be open. And we have to have 2 people on staff on site at each of the facilities during those set times. And that's been published with out in the community. The state law says that masks have to be worn inside, and we will require masks for every staff and every visitor in our buildings. We put up those plexiglass barriers so that there's that added protection. And still everybody is working remotely as much as possible. Step 3 is where the 1st of August, we will have everybody back working on site. And Todd is actually, Todd is actually helping us reconfigure some of our office spaces that are shared. Okay. So, sorry, I'm going to get there. Finger control here. Okay. So the next thing is our school, how it's reopening, and that is all state mandated. We are in Virginia phase 2, and the schools have their own guidelines. Actually, we're actually in phase 3 right now, but phase 2 is what we got approved. And so we're actually running our summer school program through the phase 2 guidelines. That's what we got approved for. We actually had a high school graduation that got on, we had a nice little NPR interview. It was a drive-in graduation.
I heard that one, actually.
What's that? Did you hear that?
I heard that one, yeah.
Yeah. So it's pretty cool. We had fireworks and we had everybody in their vehicles, and Todd and his team did a lot of work to get that set up, to have it work at a local drive-in. We sent out our approved health plan to the community on June 25th, and that described those office hours and actually what would happen during the summer school, et cetera. And then I've just shown that we're doing a limited remedial summer school, K through 3, middle school, and then the high school is remaining virtual.
Okay.
Very, very small remedial summer schools, very, very socially distanced. The kids are wearing masks. Staff are wearing masks. Phase 3 is.
And Debbie, if I can interject a question on that. So your summer school, is this something you do every year and you're just having a reduction in your capacity, or are you doing something special because of this summer, because of the shutdown?
We do remedial summer school every summer. So we usually, we're running a little bit later than normal, and certainly reduced number of students. We thought, when we originally applied for summer school, we thought we had to keep 10 and under in the classrooms. And so we had a very small capacity. And so we reached out to the principals and said, who do you absolutely need to come in this summer? And so those were the kids that we invited.
And how's it going? I know you just got started.
We have 1 week behind us, and I'll just move to the next slide since you asked. Oops, I had some pictures. There's our K through 3 staff in their masks, and we have a nurse at each of our sites to make sure. And then over to the side here, you can see kids coming in and getting their health screenings, and they're wearing masks as well. So, but I do want to go back for just a second. And
yeah, sure.
So we are now in phase 3. And so we are looking at our reopening strategy as of August 24th under those phase 3 guidelines. Virginia has some counties that have had no COVID-19. And so they are encouraging those counties to seek variance. Goochland has had low community spread, but we have a prison in our county, which has thrown our numbers off. So the prison has had a significant issue. And so if you look at our statistics, it looks like we do have a problem, and we have deaths in the community, but it's because of the women's prison that's right in the middle of Goochland County. So, but we are not truly going to seek variance because of liability. And I'm going to talk about some surveys, but just to give you an idea, Goochland is a politically conservative county. And so we have extreme views in the county. We have a lot of people that don't believe that COVID-19 is an issue. And then we have an equally strong population that's at the other end that says this is a real issue and we have to absolutely protect our kids and ourselves. So we have to we vote very strongly Republican in Goochland. And so when we implement policy, if we can stay true to the Virginia Department of Health CDC guidelines, then we can stand on that as the reason, rather than try to seek a variance that might get us in trouble. So
got it. That makes sense.
That is our thinking at this point. So there is actually a phase 4 and maybe even a phase 5 of this, but we don't know what that really means yet.
Yeah.
We haven't had a need to move into that yet. Go ahead.
Guy asked a question in the chat, and get to it later if it's better in your presentation here. But he was asking, are you trying out any of the procedures you hope to use in the fall this summer?
Yes. Yes.
Okay.
So that was one of the reasons why we wanted to push for the summer school, is to see what the kids' tolerance was for those masks, to see what the family tolerance was for those health screenings. And so far, at least in this small group, we've had good cooperation. The kids, I mean, this is the smallest group. This is your K through 3. And those kids, if they're not sitting in their desks, then they have a mask on. And that seems to be working for the morning period. So it is a test. We're going to start summer school for the middle school on Monday, and we'll see how that age group does. Right.
Yeah, keep us posted.
Yeah. So one of the questions that you guys ask is, where we're getting the data from the decision making. And of course, everybody knows that it's changing constantly. But so the hierarchy is we report directly to VDOE, and VDOE, Virginia Department of Education, sets some pretty strong rules, but their rules are based on the Virginia Department of Health, which has very comprehensive guidelines. And the Virginia Department of Health falls to the CDC. So there are weekly meetings that I attend from the state superintendent, and they're always bringing in the Virginia Department of Health, and the Virginia Department of Health person is always saying, the CDC guidelines have changed, and so this is the changes that we're going to now see in Virginia Department of Health. Now, one thing that the Virginia Department of Health has very clearly in its guidelines that is not in the CDC is that requirement to have a 6-foot distance. So that is the one variation. We require that 6-foot distance. And that's translated into the Virginia Department of Education. So I will share this slide deck with you at the end. And these things in red are actually links. And so we have this big book called, they call it the Big Book. It's about 200 pages. It was put together by superintendents and teachers and people from all over the state. It was released about a month ago. And it has all sorts of resources. And I tell you that cooperative strategies, some of the PowerPoint presentations got in, because every week that I attend these meetings, I relay that information back to the staff. And my superintendent was actually on the committee for operations for into the Big Book. And so he pulled some of those presentations and shared them. And so they are linked in the Big Book. And then we have this frequently asked questions website that we can go to, and everything from funding to Virginia Department of Health guidelines to SOL, we call it Standards of Learning, SOL tests. Those
a great name.
The annual tests that we're all required to do. The variations that will come about because of that. So everybody's looking to those FAQs to see how things are changing. We think we'll see some changes due to enrollment, that, our our funding is based on enrollment, and with enrollment declining expected across the state, that they might change their formula. So we'll see that in those FAQs as those change. And we have a very active Virginia Department of Education. They've got some great leadership, and so they are just on top of this. They are communicating very well as everything goes along. And
That's it.
Go ahead.
Yeah, no, it's just sorry to interject, but I'm curious, and I appreciate you sending us in the links. I certainly want to look into that. You've been listening to the VDOE webinars weekly. You were saying, and these weekly and so forth. From your perspective, are there trends that you're hearing? Like, we started talking about transportation in this way back in March, and now we're talking about this way. We started talking about hygiene this way back in March, and now we're talking about it this way. Are there macro level trends that you've heard in these weekly seminars? Something that jumps out to you, particularly with VDOE?
Well, VDOE has a lot of instructional and has a lot of the health plan information that they're feeding down. They are not really feeding down facilities level information.
Okay.
So it's been a really nice balance to hear from the cooperative strategies webinars, sort of those practical things like descriptions about what we're going to do about the transportation and what we're going to do about our buildings and how you do COVID capacity. That's why it's been very important to us, for me to be listening to these cooperative strategies, and Todd's attended a couple of them, but to bring that information back to my team so that they can understand some of the practical issues.
Oh, okay.
So I am a resource in my leadership team in regards to what I'm hearing both from cooperative strategies and then some of the other webinars I've attended. Because I am actually not in transportation, in operations, in cafeteria management, and construction. I am simply a resource in my organization.
Bonnie asked a question as well, Debbie, to interject here. And she's saying, the social distancing, is that something that is only applicable when people are wearing a mask, or are you requiring social distancing when people are wearing a mask? And is that different for students and children? Like, do adults, if that question makes sense?
Okay, so I can tell you from an office perspective that if we have our own offices and we can be in our own offices, we don't have masks on. When we step out into the hall, we are supposed to have a mask on. We are still, when we're in a meeting and we can still sit 6 feet apart, we're still supposed to have a mask on. So we are doing both. I think that Todd has been putting tape down, so I might let him answer this question. But I know that we're talking about students when they walk out into the hallways having to have a mask on, even though we may have them line up for the bathroom 6 feet apart. So we will, I think we'll do both until we get some relaxation from the state. So I go into a grocery store, everything may be 6 feet apart, but when I go down an aisle and I pass somebody, I'm not 6 feet apart. And so the expectation is that when you're in a grocery store or in a Walmart, that you are wearing a mask. So
curious how enforcement goes with that as you get into the summer. How is enforcement and correction going with the kids? I think that's something a lot of us have been waiting to hear about, is how can this be done in a way that's a positive and constructive environment for kids and adults while being enforcing the procedures.
Yes. So the problem is that we see it as a leadership team for the school is we're being actually asked to be at a higher standard than the community. So if we go into a store, we'll often, even though it's mandated in Virginia to wear a mask, people are not getting arrested. Some stores are not forcing people out of the store because they don't have a mask on. So, but here when we go into the school, we are saying, students, you must wear a mask. And when they go out in the community, if their parents are not believers, they are not wearing a mask. So I'm going to show you a survey.
Yeah, please.
So we actually did a community survey. I'm going to get to that in a second. Sorry. I just realized I wasn't quite there yet. I will tell you that we are the school division that has one-to-one devices for every student. So when we were forced to close down in mid-March, every student went home with a device. And so that was already in place. Except for kindergarten through second graders, they have a device, but they do not, they're not trained to use it at home. And that's sort of intentional strategy, but we're going to reverse that in the fall. We're going to teach those kids what to do with their devices at home, teach the kids and the parents so that they can be ready to do remote learning as well. The problem
I think we were on the wrong slide, Debbie. I think we went back to the equity slide there about summer school. Is that what you intended?
Yes, that is what I intended. So the very first thing is devices, right?
Got it, okay.
30% of our students cannot get good enough internet to download information or to stream. So we do supply hotspots, but for our family, but a lot of them can't make use of the hotspots. We have sent out hotspots, Kajit devices to both students and staff, but sometimes, a lot of times they're returned. They're just not of any use for those families. But we do have Wi-Fi spots throughout the county at every school and every fire station and then in other buildings. So we do have a plan in the fall that every student, if we have to go to remote learning, that every student will have to find a hotspot, find a Wi-Fi place so they can download new material. We intentionally do our instruction not requiring any type of streaming, but they will need a refresh of material every week. And we sort of equate that to every week the family has to go out and empty their trash because we don't have trash pickup in the county. So, you know, they can also go out and sit in a parking lot somewhere for 15 minutes, half hour and download material. So I talked about summer school, and then we have also, from an equity perspective, we have really been reaching out to our SPED community, and Todd's wife is actually one of our great SPED teachers, and so she's doing face-to-face tutoring now this summer, also under these very, very high social distancing requirements. But we have been doing a weekly check-in to all of our families. That's how we've tried to connect with them.
Do you have any buses that are Wi-Fi enabled?
Not yet. We have considered it. We sort of pulled back on it. It was intended to be for activity buses. And we stopped all field trips, so we did not follow through on that. So from an equity perspective, darn, I can't keep on. All right, we did a community survey. We released it June 17th, and we've had a phenomenal response. So we have 2,600 students, and we had 20,000 responses. We did We did ask we did ask parents if they had both an elementary and a secondary to do two responses so we could separate that data. So I can't tell you how many unique responses we have, but of those 2,000, 70% were parents, 15% were employees, 12% were students, almost all high school. And then we also opened it up to the community if they wanted to respond. We had pretty equitable response. Our Title I school on the western end of our county, the part of it, the most remote from Richmond, it's the most rural, and they have poor internet access. So we're trying to figure out a way to get some surveys, information out to that part of the county in our next round. But of the responses, 16% said they're only going to allow their children to participate remotely. So that would be virtual learning. Only 82% said that they were okay with staff doing health screenings. So we got a little bit of education there to do. So at the elementary level, 38% said they did not want any type of remote learning. So if we have to move back to the remote learning model, we have 38% that just aren't going to do it. And we saw that already in the closure. We had some, what they call virtual absences, kids that just didn't participate. 43% of elementary parents do not want their students in mask at any time. So that's a pretty high percentage. At the secondary level, 27% said no remote learning. These are the parents. 33% said no mask at any time. And then 25%, this was just a side question we asked, would they like a twilight school option? And 25% said, yeah.
Interesting.
Yeah, so.
That
was my question. Could you talk a little bit about the twilight?
So we're probably not going to offer the twilight option, but it was an evening option. I know Todd's going like, no, that's what my staff clean. So anyways, I don't think we're going to offer the twilight option, but we did want to see what type of response we would get. We have a slide later where the high school says they can't open at the capacity that we want. And so maybe we do need to revisit some type of twilight to get all those students in. The employees, 19% said they did not want any student contact. And then 24% said that they did not want masks. So we do have a staff education issue as well, just like we will for the parents and students. And then this was done 2 or 3 weeks ago. So, you know, the attitudes may have changed, may be changing with more of the country sort of accepting the mask as a good thing to be doing. Other students, 13% said, the high school students said they only wanted remote, and then 77%, so a lower percentage than their parents, said that they were okay with staff health screens. And I can't actually see my response, but a pretty high percentage of them also did not want to wear a mask. So I think if any, the community survey helped us a lot. This was a first pass. It was a pretty extensive survey. And it did ask for other options, you know, like what if we opened up 1 day, 2 day, 3 day, 4 day, AM, PM, alternate weeks, etc. I haven't discussed that here because I wanted to go ahead and go into sort of our strategy.
Okay.
Sorry, can't get these slides to move easily. Sorry. Okay. We have actually, well, you know, everybody knows that nobody's going to be happy. We are considering a 4+1 reopening strategy. So this was sort of rolled out yesterday. based on the community survey and what Todd was able to find out about COVID capacity, we think that we could get most of our students in 4 days a week. And we would divide them into 2 cohorts right from the beginning in case we had to change that to an every other day, or maybe an AA BB option. But anyways, so 64% of our students would come in for 4 days. The 5th day would be for our weakest students to allow them to have 5 days of instruction like normal. And that 5th day, those students would be working with teacher specialists only. The 5th day for core teachers would be working with the 20% of remote learners that we think we're going to have. And I told you we consider the AMP option, every other week option in Twilight High School, and they do not want to pursue those at this time. Our next steps are to get teachers to really sort of tell us what they think about this plan. We'll regroup next week. We have to present something to our school board on July 14th. As soon as the school board approves whatever we've finalized at that point, then we're going to send out a survey to the families and staff. And at that point, we're really going to say, it's, you know, is your child going to ride the bus? Is your, you know, which are you going, if given this option, are you going to go remote or are you going to come to school? And that will really define whether this is a viable option or not. So that's where we are right now. This is, I asked my boss before I put this out, I said, can I get on a national webinar and tell people what this is before it's gotten very hard? He said, yeah, go for it. So take it for what it's worth. We may get something else from the school board. We actually have a retreat before the school board meeting. So we'll go over this where they can talk about it for quite some time. And then we'll find out again whether the survey, whether the families and staff will support it. So it is still a work in progress. From transportation, does anybody have any questions on that?
Somebody has a question real quick, Debbie, about masks, or really about who's supplying the masks. Is that students? Is that the district?
Oh, actually, Todd's got all that PPE stuff under his control. He's been in all those purchases and conversations. He's the health plan guy. So we'll talk about that in a minute.
Got it.
Sorry. All right. So in our survey, we found out that 31% of our secondary and 34% of our elementary students would not be riding a bus. That may not be much higher than what we normally have.
Okay.
We have a Virginia approved health plan right now that we can put one kid. So this is one place where we don't have to keep the 6-foot social distancing. We did get a variance on that. And it truly was a variance because if you listen to the superintendent's weekly calls, that they're still saying every other row. So we're allowed to have one kid per row, siblings can ride together, and masks are required. So that's 22 kids on each of our buses, and we do have fairly long bus runs. So the idea of a staggered start time is something that we might have to consider, or requiring more private transportation. So we'll find out from the survey which direction we have to go into. They are doing some health screenings. Well, they're doing the health screenings right now on the school side, but because we stop at the end of every driveway, that's why our bus runs are so long, and we're rural.
Wow.
That a lot of times we can get those parents to do a health screening. And so that might be something that we're going to do to as many as we can, before they ever ride the bus.
Like have a parent attestation or something that they can give you a form or give you a blessing that the kid's okay? Or screen the kid yourself?
They will screen the parents. Right now, we're expecting parent screenings. We do have thermometers that we can use, and we have them at every site. But Todd Todd's in more of those meetings than I am, so he might be able to answer that question. But I will tell you that their cleaning protocol right now is a 20-minute cleaning after every run. And so that's 5 minutes cleaning. You let the disinfectant, do its thing for 10 minutes, and then you wipe it down. So if we have to stagger our start times, you can imagine it's 20 minutes of cleaning, and then we have an hour run. So that's quite a gap. So it may have to be, well, we're not sure. We really need the data to support those staggered start times.
Yeah, we had a question, what do you do if you screen a kid at a bus stop and they have a fever? And are there any kind of considerations for incentivizing parents to transport?
We are not currently planning on an incentive. We have a lot of parents so for summer school, we offered it, but we had it at hubs instead of the end of their driveway. And the parents said, no, I'll just drive my kid. If I had to drive them to a hub, I might as well drive my kid in. And so
got it.
Some parents opt to drive their kids rather than have them sitting on the bus for an hour. So we do have a lot of parents showing up, driving their kids. Now, I suspect that a lot of those parents are carpooling to a certain extent. So whether they'd want to carpool or not is another question. So, if you don't want your kid sitting with 20 other kids on a school bus, do you want your kid in a carpool? So I don't know. But yes, we keep on talking about, trying to encourage parents to drive. So, but there is no financial incentive for that at this point. And then we do have, Todd will tell you, we have an electrostatic disinfectant cleaner on back order. And if that works well for the buses, he's going to order a few, but you can't get them right now. So.
Debbie or Todd, what's your, Jennifer from California question, what is the procedure if you screen a kid at a bus and they have a fever?
So because we stop at the end of the driveway, we think we can encourage them to turn around. And there's some thought about, if the kid doesn't look just like really healthy, do you just say to the parent, your kid doesn't look very healthy. Would you please drive your kid in? If you still think he's okay, would you drive him in and let the nurse check him out before he comes in? The other thing is that we're sort of thinking those kids sit at the front of the bus as socially isolated as they can, and go ahead and allow them to come in. So we haven't worked through all of that yet.
Are there requirements for parents to be with the child at the bus stop?
Todd, do you know, is it through third grade?
I don't know that information. I'm not directly involved with transportation, more the
right
disinfection end.
I thought maybe with your younger kids, you might have known what the rules were.
They get driven in by mom.
Okay, that's true. So anyway, yes, to a certain age, they have to have a parent or guardian at that bus stop, or the driver will not leave that child at the end of the day. And most parents sit with their child. I see them all the time when I drive in. You know, the car is at the end of the driveway, and the bus shows up, and the parent and the child comes out of the car and hops onto the bus. So that's our situation in Goochland.
Got it.
Then we haven't talked about food service a lot, but we have 47% based on the survey that said they're not going to buy any food from the cafeteria. Again, that might be representative of what normally happens. We have 29% free reduced lunch eligibility in our county. And so that might be about right. We have about the same amount of federal money as we do local revenue coming in for the school cafeteria. So that could be about right. Our intention is to serve regular fresh hot meals every day from the school cafeteria, but our change will be on disposable trays. Our intention is to have classes come in staggered lunches, staggered groups, and we've got a tentative health plan already approved for that by BDOE. And Todd can tell you about how he's put the tape down and all that good stuff for the cafeterias. We're not requesting delivery to the classroom option except for pre-K through second grade, because we don't think they can maintain that social distancing, carrying their food and standing in line and all that good stuff.
Okay.
So we probably can handle that little bit of delivery without the extra costs. Breakfast we can definitely do as a grab and go. We have kiosks already. We have sort of got that option going at all the schools anyway. And Todd did some COVID capacity in the cafeteria. It's around 55 at each of the schools, but I don't think that we can do that with the tables. But, you know, if we had to use that room, it would be 55.
Got it.
So now I leave it to Todd, the facilities expert. Go, Todd.
All right, thank you, Debbie. Yeah, we'll go through how we determined our COVID capacity. Based on the square footage available in all the traditional classrooms, we determined that we can fit 80% of the current student body in the traditional classrooms. This will allow for 50 square feet per person, allowing 4-foot radius, 8-foot social distancing. So the number seems to be smaller than what we've seen in other models, but again, allowing the 4-foot plus 4-foot, we're feeling pretty good with the room scenarios laid out at that 50 square foot per person. In order to achieve that, in order to get those ratios, we're removing all the furniture that's not a desk or a chair. As a result, the rooms are going to look very different this year. It's very sterile looking. We've gone ahead and got some rooms staged up so we could make sure in real life these numbers are going to work out for us. And part of that sterile environment is also so that we can effectively disinfect the rooms with the short amount of time that we're given. The pre-K and kindergarten, they're going to look a little bit different. We just worked that out this week, where we're going to be using some of the existing shelving, some of the existing bookshelves to create physical barriers, knowing that the young kids are going to be the most difficult to keep socially distanced. If we can create these physical barriers, hopefully that's going to help the teachers out a little bit. When it comes to the toys and the stuff for the smaller classrooms, again, the custodial staff is only going to be able to focus on the rooms and the desk. If the teachers are going to continue to have toys and learning tools, they're going to have to be responsible for that. But we're really encouraging them to take everything out and leave them as bare as possible, and any toys or belongings will be identified for each particular student and not community use. We've rented a warehouse this year just for the storage of all the mixed-use furniture. So we developed a team, kind of hopped into action pretty quick, and we're going to start moving stuff out next week in preparation to be ready to go by the beginning of August. So the facility can fit 80% in their current capacity without much trouble. If we were to expand higher, if during the school year it turns out, hey, my friends are at school, things are looking good, and we need to expand, but we need to keep that social distance, at that point we're going to start going into different areas such as the media center, band room, chorus room, which probably won't be used for those traditional programming.
Got it.
Yes, go ahead.
So you're just using right now. You're basing these capacities on the classrooms that currently get capacity, and only recapturing other classrooms later if need be.
Correct. If enrollment is at the 80%, and we're seeing that through the surveys. So, but what we want to do is kind of have the dimmer dial so that we have the ability to dial it up or dial it back without rocking anybody's world.
And just from a baseline perspective, Todd,
yeah.
What kind of utilization have you been running your schools at in the previous years? Are you to your max capacity? Are you 80 to 100%
Sure.
capacity? Are you underutilized? How are you doing?
That varies from one end of the county to the other. As Debbie mentioned before, there's one part of the county that's right by Richmond, and that's the wealthier, more populated area, and those are at or above capacities where we were using the learning cottages. The western end of the county, it's the opposite scenario. There we have a little bit of room. Currently, we're not planning on moving any of the boundaries around to meet that.
Okay.
At the 80%, we feel like we can fit students in the traditional space.
Okay.
So that's taking a look at it from the facility point of view, how much meat can we get in the seat? But the teachers are going to need to staff this, and they're thinking 60% is going to be their number in order to appropriately staff it. And
that's at the high school only.
Okay.
Thank you very much.
Right.
That kind of goes through some of the COVID capacity. Was there any question on how we got to those numbers? All right, and we'll move on.
All right, I'm moving you, Todd. Just one second.
Personal hygiene. Here's where we're going to get into the PPE. At March, before we shut down, the superintendent gave ahead and authorized us to find as much PPE as we can to get us through the entire next school year.
Okay.
So we started in March, and we have nearly met that goal. Very fortunate, because some of my colleagues that didn't start as early, they're finding that they're going to have some shortcomings come fall. The one thing we're still down on, we're not feeling we can certainly open without it, is the disinfecting wipes, and then Purell that actually fits our dispensers, but we're going to be able to work around both of those. Cloth mask, one has been ordered for every student and every staff, plus we've got, I think, 6,000 disposable masks. That's one at the beginning of the year, along with when a student forgets it, or the nurse's office. Again, the PPE has been provided, and we've got it in stock now for the nurse's station. The elementary schools are almost eligible for Social Security here. So they were built without hot water. So we realized that was a health risk. So that's been a major undertaking. We should have that done by August. The separate isolation room, which I saw in the chat there, we've got those identified, and we've also got the method to disinfect it, air it out, have the other one on standby. So if we have 2 cases, we're in a bad spot as far as the isolation room goes, but we've really tried to cover our bases concerning separating possibly 6 students. And then lastly, as far as the personal hygiene, we have a Google Doc that currently the teachers are filling out, staff, before they come into the building. I think it's just 2 questions. Hey, do you have a fever? Have you been coughing, sore throat, and whatnot? And realizing we might need to change that because everybody's got a sore throat nowadays. But that's where some of the steps we've taken as far as the personal hygiene. Any questions there? All right, we'll move on. The facility changes we've made post-COVID, we've been researching HVAC options. I heard a lot of great discussions here on this seminar, along with some Johnson Controls and some other groups. So we've been researching the UV and ion charged disinfection. We can only do this currently for our common spaces. Currently, the systems we have are individual heat pumps for each individual classroom. And then cafeterias, gyms, they're on the larger common systems. So the fact that we're up to about 400 something heat pumps, it's just not financially feasible to put UV in each one. But we are looking at those disinfection systems for the larger units. One of the things we did, it was an easy change, just change the floor wax to antibacterial. I'll be honest with you, I don't know if that's really gonna be that effective, but it's one of those good PR things, helps the community feel a little bit better about the reentry. Yeah. We're taking down the water fountains and replacing them with water bottle filling stations. Something we were in transition before of doing at least half and half just to encourage water bottles. But we're just going to go and get rid of all the water fountains at this point. I don't see us going back to them when we're post-COVID. When school returns, the custodial department is going to continue the increased disinfection frequency we had just before we left. I feel like we really kind of nailed down an effective system where we could get into the classrooms, get them effectively disinfected, get out of there, meet our time requirements, but also create that accountability. And that was the most difficult challenge in this, is getting that staff on board and knowing every morning we're following up on you. And if something's not meeting our standard, we're going to be having a discussion. And it was a difficult month, but we made that transition. That said, we know there's going to have to be vigilance with that department and continued training. So that's going to have to be just a lot of systems to create that accountability. To get that 100% disinfection is critical. And then, as we talked about before, the custodial team is only going to have enough time to effectively disinfect the rooms and the chairs. So if teachers are going to have additional items stored in the classroom, we're just not going to be able to be responsible for that. So it's going to have to be a shared responsibility, and the teachers will have disinfecting supplies. This is also to increase disinfection and help their peace of mind.
Yeah.
That it's been done. So is that it, what we had for?
That's it, Todd?
Yeah, this has been very helpful, and I appreciate the presentation. And apologize for my teenage neighbor with his fireworks outside my window right now.
Nice.
But, quick, on the cleaning schedule there, Todd, is that a daily thing? Well, what's the frequency that you're talking about with that cleaning?
Sure. In fact, we kind of transitioned from a cleaning mindset to a disinfection mindset. So before, it might be that every 3 days they were doing the windows. They were doing something that's not directly affected to disinfection. So as a result, we've had to scale back some of the frequency of what I call cleaning and scale up the disinfection to make sure that we know that every chair, every frequently touched surface, every flat surface has been disinfected and documented.
Every day?
Yes.
Every morning they come in, all the desks, all the surfaces.
In the evening, but yeah, exactly. And then also it allows time for the teachers when they come in. If they see something that's a little bit off, I get an email, I promise you, and we have the staff to get that fixed before the students arrive.
Got it.
Any other questions?
And I just put the presentation with links on it. So if anybody wants to pick that up, or you, David, there
Awesome.
it is.
Yeah, we will, Debbie, and Todd, thanks very much. We'll go ahead and put that, share that out to the group. We'll put it on the website with all the presentations as a resource. And I appreciate you taking the time, and especially getting those links out so we could kind of see some of your source data and what you're referencing. That's great. So, yeah, many thanks. This is great.
And we're hoping that all the states that are having some difficulties in their reopening strategies stay away from Virginia so that we can stay steady and reopen.
We love you, but stay away for a little while.
Yeah, that's right.
Yeah.
We're all trying not to go to the beaches. Actually, we all are. So we're probably doing it ourselves.
All right. Okay. Well, I mean, everybody, happy 4th, happy Independence Day. You know, enjoy the time. Everybody on this call deserves a few days of R&R for sure, if you can get it. And next week we'll be talking to Guy, and he's has some information to share. He's doing some presentations next week on security related items, and has done some research on liability, and just has a statewide perspective there. So grateful to have his perspective next week, and you know, get that back and forth between the state and the locals, you know. So all right, everybody, well, have a wonderful rest of your day. Enjoy the great long weekend, and we'll see you next week. Take care. Bye, Debbie. Bye, Todd. Thanks again. Thanks, Mary. Thanks for joining us.